All right, so where I live, we caught the edge of that big storm that went across the country last weekend. 200 million people were under the effects of that storm. Heavy snow, ice, problems, power outages, people still without power today. On Saturday morning here at the studios, it was minus 25.4 degrees ambient air temperature, the real thing. That's kind of sharp. If you're not prepared, you're making a mistake. And I mean all things in the cabinet. I mean food, water, maybe ammunition, whatever it is that you think you need, you should have. What about medications? Dr. Peter McCullough is the Chief Scientific Officer at the Wellness Company. He joins me now to discuss preparations in cases of emergency. Doctor, good morning.
Good morning.
People think about going, I mean, I saw these lines, you saw this too. They're at the grocery store, their carts are packed full. I mean, does anybody plan ahead anymore? I mean, they got 12,000 rolls of toilet paper. I'm like, really? You're not ready for this? But the thing they don't think about, and with all the pharmacies closing across America, what if you need that medication for diabetes or blood pressure or whatever else it might be? Or what if you need a good emergency kit because you cut yourself when you're home and there's no power? People do not think ahead enough in this country anymore. What are your thoughts?
I agree, and they should think ahead regarding medications, particularly emergency medical kits. I'm in Texas, Steve. We haven't been out of the house in 5 days. We can't get out the back of our driveway and alley. So listen, even if even if the pharmacies are open, sometimes you can't get there. I've had patients that can't get mobilized. Everybody should have an emergency medical kit at home per person at home. 8 essential medications, treats over 30 diseases. I had multiple patients actually develop problems, and thank goodness they had the kits, and we were able to solve them at home.
I am a believer in these kits. I have them here, right, so I can show people. Here's the original. It is the medical emergency kit. Antibiotics, it has antivirals, antiparasitics, and a whole host of other things. And there's a book in here. I mean, most people aren't doctors. There's a book in here to explain, okay, if you have this situation, here's how you use this medication. It's very simple. It's user-friendly. Explain what I will find in this kit for the folks that might not have one yet.
Well, this is what has happened over the weekend. So one of my patients had a viral illness. It progressed into a sinusitis. Well, you can diagnose the sinusitis yourself, use the guidebook, call telemedicine if you need it, or bronchitis. She started the appropriate antibiotics, and it literally cleared in about 4 days. And she didn't miss work. She didn't have to go into the urgent care. It was so worth it to have the emergency medical kit at home. And, now that some of the medicine has been used, she can use the replenishment program and then get the bottle refilled.
Yeah, and it's not just that. The Wellness Company, your team, Doctor, and I applaud you for this. You came out with the original. This is a great kit. I have it here at home. And then last summer, I burned my hand badly in a sauna. And we're 20 minutes from an ER, and the skin was coming off the back of my hand, a little belch of steam, and I'm like, wow, I have a problem. I went to this kit, the first aid kit. It was right here. Ivy and I had everything we needed to treat that hand before I saw a doctor, which greatly reduced the recovery time. Everything I needed for an emergency was right here. Look, if the roads are covered with snow and ice, an ambulance can't get to you if something bad happens. You need to be able to be prepared at home to deal with at least minor emergencies. What's in this kit? How important is it to have one of these?
That's really a first aid kit if you're out camping, out in the woods. But I have to tell you, we were on a ski trip up in the mountains in a condo, and actually one of our members burned their hand baking cookies. It was the same thing, Steve. But thank goodness we had all the burn treatment materials and medicines there. And I treated the burn, actually. And just like your situation, we avoided major skin contractures, problems later on, infections, and having to go to urgent care. So I tell you, all of us, no matter how adventuresome we are or how conservative we are, we still need an emergency medical kit.
And one of the other things that's in here, because you're on vacation, like you mentioned, or you're snowed in, or whatever the case may be, and all of a sudden you have an anaphylactic shock, and you have no way, and you have moments to figure it out. An EpiPen, it's indispensable because you don't know. My father nearly died as an adult because he ate shellfish, had no idea he was allergic to it. He happened to have epinephrine. He was a pharmaceutical rep. He had it available. Short of that, I would have lost my father a lot earlier in life. Those sorts of things are here too, aren't they?
They are. Now, remember EpiPen, you need to follow up with a trip to the emergency room because there can be rebound. But in there, products to handle acute allergies, uh, difficulty with respect to, acute strains and other injuries. And I think a lot of the material in there, actually, Steve, is to stop bleeding. The
Yeah.
bigger gouges that you can't manage with simple pressure, we have all kinds of tools in there to help stop major bleeding before there's too much blood loss and you end up really in trouble out in the woods somewhere.
Yeah. My advice, be as paranoid as a Boy Scout. In other words, be prepared is their motto at the Boy Scouts. Be prepared. All right, before I let you go, flu and COVID and other upper respiratory illnesses running around. It's run through this house not once but twice so far this winter. What's the latest?
Our CDC says we're on the 14th wave of COVID. It looks just like the common cold or the flu. I'm still seeing cases that need the treatment McCullough protocol. That is, multiple drugs in combination. I think the lead is ivermectin. Rarely have to use corticosteroids, sometimes secondary antibiotics, but it needs to be treated. Ultimately, people who don't treat these early viral infections can end up with some problem. Recently, Steve, I had a patient have this, went untreated, it's a case of COVID, ended up with a huge blood clot, and it nearly took her life. So treat COVID-19 early, treat influenza early. All the materials you need are in the emergency medical kits. The black kit fills all those roles for these acute viral infections.
The contagion kit. Several different kits to choose from, Doctor. Your team has put together the best kits because you put a lot of time, effort, and thought into what people would need in different situations. Sir, thank you for being here.
Thank you.
Get your kit today, twc.health/Gruber. twc.health/Gruber. This is just two of the kits. And trust me, when I burned myself, this was a great thing to have on the shelf. They have a travel kit, a kit for children, the contagion kit, twc.health/Gruber. Don't be unprepared, okay? I'll be right back.